Welcome back. You know, May is Stroke Awareness Month, and every 40 seconds, someone in the U.S. has a stroke. Even though strokes are often preventable and preventive, and today we have Secours vascular surgeon, Dr. Jeffrey Johnson, joining us to talk about maybe awareness and prevention. Doctor, good to see you.
Dr. Johnston, thank you so much for joining us. So everyone's talking about strokes right now. There's no age associated with it. For folks that don't know what a stroke is, you know, we throw around the term, but a lot of people just don't know medically what's happening when someone has a stroke.
Well, strokes can either be caused by a blockage in the brain or a bleed. And identifying a stroke is very, very important. There's an acronym that we use to identify signs of stroke: BFAST. B stands for balance issues. Mm-hmm. E for eyesight, whether you have blindness in one eye that occurs suddenly. Mm-hmm. F for facial droop or facial numbness. A for arm weakness, arm numbness. And S for speech difficulty, slurred speech. And then T is time to call 911.
Well, what's the relationship between the heart and a stroke in the brain? I think we think of you guys, strokes and heart as the same type thing. But
so there can be cardiac origins for a stroke, or strokes can be caused by disease in the carotid arteries. And that's what we have to delineate. When you have those symptoms, you come in and we identify what the source would be.
And that's that big artery that runs
the
up
two
your neck?
big arteries in the front of your neck.
Yeah.
Let's talk about how important treatment is. Obviously, when you start identifying some of those signs that you may be having a stroke, how do you know that maybe should I call my family physician, my family doctor, or get to the ER as fast as possible?
Well, in treatment, it's very important to get fast treatment for a stroke. We have a saying, time is tissue. And so treatment usually for blockage of arteries, we can medically treat that up to 4.5 hours from symptom onset. So it's very important to get seen by a physician or a healthcare professional quickly.
Yeah, and speaking of treatments, you guys have a new treatment solution that you guys are using.
Yeah, so at Secours St. Francis, we just started back in January transcarotid artery revascularization, which is TCAR. It's a hybrid procedure where we combine the better outcomes of open carotid surgery with the minimally invasive aspects of carotid stenting. And so I make an incision just above your collarbone, and I'm able to go down to the carotid artery and place a stent.
How big is that artery? I mean, it's mammoth, isn't it, compared to?
Well, you know, less than 1 centimeter in size, but you know, we deal with everything in medicine in centimeters, so it's a little bit difficult.
A lot larger than other arteries, I'm saying.
It's a significant artery.
Yeah.
So
now tell me this: baby aspirin every day?
I recommend seeing your healthcare provider regularly, and so what they can do is they can preventative medicine as well as screenings. Baby aspirin, cholesterol-lowering medications prescribed by your physician, as well as avoiding tobacco use, healthy lifestyle, eating a balanced diet, exercising regularly, and then of course treating diabetes or high blood pressure is very important in stroke reduction.
It's good to have that screening to kind of know what your family history is, so you know that too, and like you said, living a healthy lifestyle.
Exactly.
People can always call you guys and set up some appointments to kind of get some of those screenings done.
For sure, they can contact us for screenings. The best thing is to have regular visits with your healthcare provider so that you can be regularly seen in the system, so that we can catch things earlier rather than later.
Do we need a referral from our regular internist to see you, or can we see you?
You can come directly to us without a referral, but it's also possible to see your healthcare provider and have a referral to us.
And you're of St. Francis of
Yes, sir.
Yep, great information.
Yep.
So definitely identify those signs and symptoms, and stay healthy. Take care of yourself. Thank you, Dr. Johnston.
Thanks, Doc.
Thanks for having me.